everyone, and welcome to the Alexa Show. My name is Alexa Servodidio, and I am your host. Thank you so much for tuning in tonight. Tonight, I have such an incredible show planned. With us is Carolyn Wilson from GASP. Carolyn, welcome to the Alexa Show, and thank you so much for joining us this evening.
Thanks for having me, Alexa.
Of course. So please tell the viewers a little bit about what GASP is and what you do.
Sure. So I'm a health educator with Ledgelight Health District, which is the health department that serves most of southeastern Connecticut. Mm-hmm. And one of the things that I do, my primary responsibility, is to coordinate GASP, which is the Groton Alliance for Substance Abuse Prevention. So that keeps me pretty busy. Mm-hmm. And I also do some tobacco cessation work, so I help adults quit smoking.
Wonderful.
Yeah.
Definitely. Well, you're involved in so many relevant and very pertinent issues. How is it, what have you been seeing, with this drug prevention and also with the vaping and the cigarettes? It's just been so much on the rise. I mean, you can't watch television or go around the corner without seeing someone vaping or smoking or speaking about drug addiction.
Totally. It's really very pervasive in our society, and it's a confusing time, especially for youth. We've got new products coming out, and we've got laws that are changing. And so a lot of what I do is educate youth on harms and consequences associated with use of different things. With the vaping, boy, that really threw us for a loop in the prevention world. I have to say, it took the public health field a long time to get it right with tobacco, to get the laws changed. You might remember that huge lawsuit that happened about, when we really figured out what the risks were.
Yes.
And as a result of a lot of hard work done by policymakers and public health advocates, smoking rates went down. Laws changed. You couldn't smoke in certain places anymore. And that was really great public health work. Mm-hmm. And prevention was part of that. And when we started to see tobacco use rates coming down, I think preventionists took a step back from tobacco because it just wasn't cool anymore. Mm-hmm. And the use rates were down, and it just seemed like we could ease off of it, talking about it. And then it seemed like almost out of nowhere, we see e-cigarettes come into light. I think at first they were really marketed as a way for adults to quit smoking. Yes. It was seen as a cessation tool and sort of as a harm reduction tool for adults. And then, the marketing genius got a hold of it, and kids started becoming very interesting in it, and the industry seemed to almost be skewing some of their marketing towards kids, and it was really alarming. And then, because we had backed off from talking about tobacco, it was kind of a perfect storm.
Yes.
Of marketing and curiosity, and the vaping. Some people describe it as an epidemic, and the kids, tell me about it. They say that in school, kids bring them to school, and schools have had to change their policies to catch up with that. They used to have all the tobacco policies, and then they had to make sure that vaping was, included in those policies.
Because I find, as we remember through the years, all those scary commercials about smoking, as we can imagine, the ones with the tubes and the holes in the neck. So, of course, that could really scare people to stop smoking, and we became more educated on it. And with the vaping, though, it almost came in as, this is so easy. It's not smoke. Right. It's not anything. But a lot of people think it's just really smoking air or inhaling air and has not any dangerous effects to it. Right. In fact, there is a lot of dangerous effects, and I think can be just as addictive as cigarettes.
Absolutely, and that's a big piece that we're really working on with kids, is to educate them about nicotine, because when we stop talking about tobacco, we stop talking about nicotine, and they may not have understood that many of these products have nicotine, and they can absolutely get addicted to it. And in the teenage brain, it's super vulnerable to the effects of nicotine. And it can make you more vulnerable to become addicted to other things. So very interesting time for prevention. We're really trying to work on the vaping. I think the government's cracking down on the industry a little bit with some of their marketing tactics. But yeah, it's certainly something that's very current and we're spending a lot of time on.
And what I find really must be confusing for children, and also as myself as an adult when vaping started coming in, they're candy flavors.
Right.
They're fun flavors. So at first you think, oh, it's, I remember when I was very much younger, they had those gum type of cigarettes, and it was like powdered gum.
Yeah.
So I thought maybe vaping had something to do like that. I didn't realize it's chemicals. It's not just powdered sugar that they're vaping. This is serious chemicals that are being put into these products.
Right, and even more proof when they make things appealing to children. It's like, not a lot of adults are interested in cotton candy. That's not something that a lot of adults are reaching for. So that sort of suggests that maybe the marketing, they sort of knew what they were doing.
Yes.
So.
Because if you think about it, what adult person is out on a Saturday night or having dinner and is like, let me vape my cotton candy birthday cake flavored vapor.
Yeah.
And I think they are really targeting the children. And I think also now with a lot of changes that are coming with legalization and recreational marijuana, it's such a confusing time for adults and for children. What's safe, what's not safe. And I know so many times through the years, if we relate it to dieting or, this carb diet or, protein diet, vaping, cigarettes, and marijuana are in a total different field. This is not about what this is safe now and it wasn't safe. It's just not safe to do.
Right, exactly. And I'm glad you brought that up, Alexa, because marijuana is a really hot topic. And kids are confused. Parents are even confused. How do I even talk to my kids about this? Because the laws are changing. And is it safer than alcohol? Should I not really care if my kids use? Some parents may use themselves and might provide it for kids or be permissive of use. So that's kind of an interesting thing that we're seeing. The legalization and commercialization are certainly having an effect on kids' perception of whether or not it's harmful. And we know that really, for teenagers, no substance abuse is safe.
No.
With their vulnerable brain, like we talked about with the vaping, they're really putting themselves at risk to become addicted to anything. And it's just, we're up against a lot. The industry that supports marijuana and tobacco and vaping, they've got a lot of money. And prevention, when you're lucky to have grant funding, we can do some excellent work. But it's not quite like the industry and the lobbying funds that they have. So they outspend us, and it's certainly a tough battle to fight.
Yes, and I think they're also, you start to think about if someone is using marijuana on a regular basis, they're self-medicating. Especially if there's mental health issues. I know a lot of people say, it's better for anxiety. It helps them so they can do public places or maybe not get sick before they go to work or something. But the fact that you have to self-medicate and it alters your state of mind, I think going to a doctor and getting psychiatric medication, I know a lot of people don't want to do that. But at least we have more studies and safety, and you know where you're getting it from, than with marijuana, which causes you to be in an altered state of mind no matter what people say. You're in an altered state of mind.
Yeah, absolutely. And what's appropriate for an adult is not necessarily appropriate for a kid. And certainly with medical marijuana, those conversations can happen between providers and their patients, and that might be something that can come up in treatment for sure, but that's another area that's making it even more cloudy for kids. Why is this bad for me? It's considered medicine, isn't it? I have stress, I have anxiety. Why can't I use it too? And it's there's still a lot of research that needs to be done, and it'll be interesting to see over the next couple of years how everything's going to play out, and hopefully more research is done and we can find out more about dosing and frequency and different blends and see the therapeutic value of it, and then be really real with kids about what's okay and what's not, and even for adults, because I'm sure they're confused too, especially with people talking about CBD versus THC. There's so much out there to digest.
Yes.
People, I was going by a gas station the other day and they had a sign up that said CBD sold here. And I'm like, it's being sold at a gas station? I'm like, and then I look to see what it is, and it's gummy bears. And I'm like, are these for adults or are these for kids? I mean, I don't know when the last time you bought gummy bears, but I haven't bought gummy bears in a long time. Usually that's a kid's product. And it's just interesting to see all this play out. It's confusing, and it certainly complicates my job in prevention and the conversations that I'm having with parents, with kids. Parents are having a hard time playing catch up. Like, what do I say?
Yes.
What do I tell my kids? They have questions, and unless you're an expert in the field or you're constantly doing research, it's hard to stay on top of things.
I think it gets confusing too, is this for fun, kind of a candy thing to take, or is it because you have different types of symptoms or anxiety or type of depression, or with the vaping? Because a lot of times they're getting some sort of symptom from it. They're getting some sort of reaction. I'm hearing a lot now, a lot of the vaping, people can start getting high from it. And of course, when you go to a psychiatrist and you get medication, the medication technically doesn't, okay, my anxiety's gone, I'm back, I'm totally, everything's different. You have to work on environmental stressors, what's going on, family stressors, what are you doing to take care of yourself? Where if you're smoking marijuana, you're sitting home, you're smoking, and now all your problems are going away, which is kind of denial. You're not solving anything, as if you were going to see a doctor and also work on what are the other areas of your life that you're improving.
I think when medical marijuana came out, it was mostly meant to be treatment for people who are deathly ill and people, palliative care. And then the list of things that it treats has expanded. And I'm looking forward to seeing more research about the effects of marijuana and mental health, especially when we're seeing kids, use. And we already know it's bad for them. Anything under 21, you're putting your brain at risk.
Yes.
But it'll be really interesting to see, because I wonder if any of those recommendations will change as we learn more.
Because it's frightening, because I just saw a commercial where they're saying CBD oil is great for weight loss. I mean, how frightening is that? People might just try it, just to try it. And we honestly don't know what chemicals are put in there, especially if it's not coming from a doctor or if you're being sold at the gas station. How do you regulate what's being put in all of these different products?
Yeah, I was watching a segment on the news recently about CBD and how the industry is, doing a good job or aren't they doing a good job. And it seems like you really have to make sure that you do your research as a consumer, because you have to ask for third-party testing. You want to know, what's the dosage of what I'm getting? What's the purity of what I'm getting, And I don't think it's standard across the board. I think some companies probably do a more thorough job than others. And you have to know what you're looking for. So just like anything, really, you really got to stay on top of things and be an informed consumer and ask the right questions and make sure you know what you're putting in your body across the board, no matter what it is. You should know.
Definitely.
Yep.
Are you seeing a lot of fentanyl abuse, heroin abuse? Is it still on the rise? Are you still seeing it?
Well, where we're not seeing it is in kids. Kids are not using heroin directly for the most part. It's like always less than 1% when we see it. It's like maybe some kid said yes to make a joke about it. Where we're seeing some concern, but the numbers are still pretty low, are with prescription drug abuse. So taking medication that's not yours, or taking more than you need to, or just somehow misusing it. That's something we really focus on in prevention to prevent things like heroin and fentanyl use in kids. We know that introduction to opioids can happen in many different ways. So there can be a recreational curiosity exposure where people may experiment with pills and then, they can get addicted and then move on to heroin. And that supply has, obviously could be tainted with fentanyl. And that immediately increases the lethality of that. You can also see kids or adults getting exposed to opioids through an injury or medical intervention. So they've been injured, they've had a surgery, and very innocently they could be taking a medication as prescribed and getting a refill, and it really doesn't take too long for some of those really strong drugs, Vicodin, Percocet, OxyContin. It doesn't take too long for those to become habit forming.
Yes.
And so we're seeing that some adults are sort of innocently getting hooked on these pills, and then when the medical supply is no longer happening because their doctor won't prescribe it or they run out or what have you, they may seek heroin on the illegal market. And when you do that, you have no control over what's in it. And because in the illegal drug market, profits are king, there are ways to cut the supply and add fentanyl to it to make it stronger. And of course, it makes it deadlier. So it's still a very active problem. We're constantly monitoring the numbers. I know regionally there's a couple of great community programs that are working really hard on preventing death from overdose. And there are other programs that also help people get into treatment. And so we're happy to see those there. We obviously, you know me, I come from a prevention standpoint.
Yes.
I would like to prevent these things from happening. But it's great to know that if for some reason prevention doesn't work out, there are people who care that can help people get the treatment that they need before it's too late.
Yes.
And there's no shortage of resources in this area to help people. So it's very important for people to know if you know somebody or you yourself are struggling, ask for help.
So if someone is watching, a parent or a loved one or a child, or they know someone that's suffering from substance abuse or just they have a fear, how would they contact you? Do they call you? What should they do? What are the steps that should be taken?
Good question. So one of the things you have to do if you're a family member is to make sure to take care of yourself. There are plenty of support groups. I know there's a community group called Community Speaks Out, and they help families navigate the whole process of addiction, but also provide support groups for people who have a family member. So definitely get some support. And definitely the 211 line is a great way to look for resources to help somebody. And that's an online and a phone resource. And then there's the Opioid Action Team out of New London that has recovery navigators to help people get into medication-based treatment if they should desire that. And then there's all sorts of mutual aid programs as well, and treatment centers. And there's really many different options, and whatever is most appropriate for that person, there's something for you.
Yes, and I think it's so important too that people understand this isn't something they should be doing on their own, trying to get better, trying to stop use or abuse of drugs or alcohol. It's something that really you need a team, and it's not a weakness that you need a team. Everybody needs a team.
Absolutely.
And it's so important to have a community, to have an agency like yours with different things that you do, which could help them with so many different resources and also get the educational tools that they need.
Right, absolutely. You have to reach out. There's lots of resources, and the more help somebody can get, the better. And I know stigma reduction is a big thing, so we're trying to normalize help-seeking behavior and making sure people talk to people and reach out when they need it. So it's all very important.
And I know a lot of times when people get nervous, with the stigma, but also if it's illegal. I mean, if they come in and speak about it, are they, don't have to worry about that they're going to get in trouble or that the police are going to come. How does that work for you?
Well, that's a really good question. There is an effort now to try to prevent some legal ramifications for people, especially if they try to assist somebody who is overdosing. This is a good point to make. Narcan is a life-saving reversal agent for opioid overdose. And some people are afraid that if they somehow implicate themselves with somebody who's using, that they're going to get in trouble. But if you are with somebody who's overdosing and you make an effort to save their life with Narcan or calling the police or whatever, and you're trying to help them, then you're covered by the Good Samaritan law. They're really probably not going to be looking at whether or not you were using with them. Obviously, legally, there may be some charges for possession or something, but typically police really want to help people, and so do first responders. And if you come to them asking for help, they'll try to point you in the right direction. What they don't want to do is, come upon you with a bunch of stuff and in a bad situation, because they're not going to just be able to turn the other way. But the mindset now is to refer people to help and to try and help them, and not just slap cuffs on them and arrest them. In many cases, sometimes you have to, they have to enforce the laws, but you're seeing a different culture shift. Yes. And them trying to refer to treatment and get people help so they don't die.
Yes, and I've seen that a lot more, on my shows and also people that I've been working with, that the police have really looked at it more as an addict than as a criminal.
Right, absolutely.
And they really know by putting an addict in jail is not going to stop the addiction.
Right.
It's really about trying to get help for that addict and recovery. And also to try and stop this horrific epidemic, which just seems to keep going and going and going.
Right, yeah, there's definitely a trend to stop criminalizing addiction. Obviously selling drugs is illegal, but is being just addicted to drugs really a crime, or does that person really just need help? And, could you help them get their life back on track, could they help themselves if they had some treatment and a second chance? So definitely there's a culture shift, but it's not, the work there isn't over. There's still stigma that's out there. There's still some harmful attitudes, that can prevent people from getting help out there. So, it's a horrible epidemic we're dealing with, but it's great to know that there's positive resources out there and things are starting to change.
That's why I really commend you for what you do, because I think it's so important. On my shows, I like to bring up tough topics. And I want to do that so people, I know they're hard to talk about, and there's a stigma about it. But unfortunately, this is what's going on. And all of us in some way or another are affected by it. And I want to be able to educate people, but also so people can feel comfortable talking about it and not have to hide this secret. They can ask for help, and that they could save a life.
Absolutely.
And it's serious, but I think it's always reaching out. If someone wanted you to come speak to their children, their school, their local YMCA, is that possible?
Yeah, so I do a lot of things out in the community. I go to schools, I do events and parent groups. I can be reached at Ledge Lake Health District. I focus, GASP is a Groton specific program, but I have other colleagues that serve Ledyard and New London. And so if anybody needs any prevention materials or wants to get a speaker or something like that, you can call us, and if we can't help, we'll point you in the right direction.
Yes. Because I think it's so important always to have that education. And sometimes people just planting that seed.
Right.
So they could hear what you say and start to digest it and realize, what's going on? What's going on in my life? What's going on in my loved one's life? Because sometimes we need that time to self-reflect.
Right.
How are you seeing with the youth? It seems more and more they're getting more involved, and they want to get involved and able to stick up and say, hey, this is not cool anymore to be doing this.
Yeah, good point. So one of the great prevention strategies we have is social norming. And that's basically highlighting that most kids don't do drugs. Most kids are making great decisions. Kids like to play sports. They like to do volunteer work. They're getting jobs. Most kids aren't looking to make bad choices. And of course, there'll always be some that do, but we definitely want to normalize good decision behaviors. We want to show that most kids are doing the right thing. Most kids aren't doing drugs, and that's a thing to celebrate. And there'll always be this idea that most kids are doing it, but the truth is that's just not true. We know that most kids aren't. And that's really encouraging, especially in prevention.
Yes. And I think it's also encouraging for those who are not doing it to be able to maybe help those that they see that are in trouble, because a lot of schools that I've worked with have different types of programs where they actually have awards or sort of notifications when a child maybe sits with a kid at lunch who's been bullied or who's been having family issues or maybe has an alcohol problem or a drug problem, and helps reach out to that child or that fellow classmate to give them support. And I think that's so important, not to isolate.
Sure.
And to be able to have an open community, and also for kids to be able to speak to each other, but come in and speak to the adults and say, hey, I think this person is having an issue. I'm not being a rat or a tattletale.
Right.
But I'm concerned.
Right. Yeah. So there are some great student groups, and I can speak mostly to Groton because I do most of my work in Groton. There are some clubs that are really peer helping groups. And there's a Students Against Destructive Decisions group, which is really positive. There's a Renaissance group. There's a couple of different sorts of peer support groups. And it's really great to see that peer-led model, because kids sometimes are more apt to listen to one another and respond to one another versus if an adult is trying to tell them something. But youth engagement's a big part of what we try to do in prevention, especially lifting up and normalizing prevention is really key. But, for kids to support each other and to help each other, no matter what it is, with studies, with mental health, with substance abuse. I know here in Groton we have a big military population, so military kids, they're constantly switching schools. It's great to know that they've got some resources for them too to help them with those transition times. And I know that there's some high schoolers that are interested in educating their younger peers. They actually want to talk to the middle schoolers, especially for prevention. They want to give them those positive messages that, hey, when you end up at the high school, it's not all what you've seen on TV or what you hear. We like to play sports. We like to volunteer. We like to be in clubs. We're not just all, going to parties and things like that. So some good role model behaviors going on. So that's great.
Because I think, thinking about transitioning to high school, some kids might be really intimidated, especially if they're not partiers, if they don't drink, they don't smoke, and they feel like, I'm not going to fit in. Everyone's going to think I'm a geek or not. But it's not the case anymore. Right. I think it's so important that that everybody is accepted.
Yep, absolutely. Positive peer pressure is a great thing. We see how negative peer pressure can play out and influence the decisions of teens, but certainly the power of positivity and kids making good choices, and I think that can really help influence. Yep.
Are you seeing at all any self-harming behaviors? Because I know I see a lot in my practice of cutting behaviors. What is that like with the group you work with?
So, I'm a non-clinical type of person, so I hear that some kids may struggle with those sort of things. What I do hear more concretely is stress and anxiety, whether it be school or things that are going on at home. Kids worry a lot, more so than maybe they ever did. And I don't know if technology plays a part in that too, or some of the things that can happen online with cyberbullying and, changes in the way we communicate now. Or maybe it's, all the pressures of trying to get into college. Kids are pretty stressed out. Wherever I go, I talk to them and they say, yeah, we're stressed out. And I know that schools are trying to do the best they can to educate kids about coping and stress management and time management, and I know that's something that many local schools are tuned into for sure.
I think you brought up about social media. I find that access that many, many years ago maybe wasn't around, but I think it's also the stress and the pressure that everything you do or you don't do, the whole world and even outside, everybody can find out. I think that's such another different layer we have to really factor into all of this, because you're exposed to a lot different things than when you didn't have it than just what's in your neighborhood. Now you get to see what's going on everywhere around the world.
It used to be that mistakes, you could sort of recover from them, but now mistakes can be recorded and they can live on. So because of technology, things can follow you, and things can be much more challenging for kids to navigate, and they can find themselves in a lot of trouble, and a lot of public trouble. So it's a very interesting time, but it's a stressor that previous generations didn't have. And we're seeing it not play out too well. I mean, social media can be used for great things, and obviously, technology is awesome. But we can certainly see it taking a toll on the mental health of our kids, and even how they communicate.
Yes.
They struggle to make phone calls. They don't speak to one another as much. They have a hard time relating to one another. It's just interesting.
Well, we're at the end of the show, and I just wanted to thank you so much again for joining us this evening. It's been a pleasure learning about everything that you do.
My pleasure. Thank you for having me, and
definitely we'll have to have you back on for some more questions.
Yeah,
definitely.
Sounds good.
And everyone, thank you so much for tuning in tonight. If you have any questions, would like to be a guest or a show idea, please send us an email at alexas29@aol. Everyone, have a good night and God bless.